Excellent. And we're live. Excellent. Alrighty. Okay, thanks everyone for joining us today. We are here, it's a very special live. We're going to talk about CRPS. Okay, this is a chronic pain syndrome that young Jonathan has been living with for some time now. And of course, we're joined with Professor Bart Kay, his lovely partner, Pim, and of course, Jonathan down the bottom. But before we start, I just wanted to show everyone, I just got a short video for everyone to watch so we get a little bit of information on what CRPS is, okay? And this will give us a little bit more insight, hopefully. And so let's go with that.
Complex regional pain syndrome, or CRPS, is a devastating condition that traps patients in relentless burning pain, often after a minor injury. For some, it brings dystonia, uncontrollable muscle contractions. Let's explore the pain of CRPS and the genetic clues that could unlock better treatments. CRPS turns everyday life into a battle. Patients describe their pain as burning, stabbing, or electric, like their limb is on fire or being crushed. This pain, far worse than the initial injury, can spread beyond the affected area, making even a light touch unbearable. For some, CRPS causes dystonia, where muscles lock into painful, twisted positions. The trauma of constant pain and loss of function can lead to anxiety, depression, and a sense of isolation as patients struggle to reclaim their lives. The human leukocyte antigen, or HLA system, is a set of genes that controls how your immune system responds to threats. Variations in HLA genes can affect inflammation and healing after injury. Scientists believe these variations may explain why some people develop the debilitating pain of CRPS. And a 2009 study by De Rooij and colleagues studied 150 Dutch CRPS patients with fixed dystonia. They found that two HLA variants, HLA-B62 and HLA-DQ8, were significantly more common than in healthy people. These variants may make the immune system overreact to injury, worsening pain, and contributing to the traumatic muscle contractions of dystonia. For CRPS without dystonia, a 2012 study by Van Rooijen's team found HLA-DQ8 but not HLA-B62 was more common in 131 patients compared to controls. This suggests HLA-DQ8 may drive the excruciating pain of CRPS with or without dystonia by amplifying inflammation that feels like a never-ending wound. Other research links HLA-DR13 to CRPS with severe spreading dystonia, often in families where CRPS runs deep. Beyond genetics, the trauma of CRPS is profound. Patients face not just physical pain, but the emotional weight of losing independence, battling disbelief from others, and fearing their condition may never improve. These HLA findings offer hope for understanding this complex suffering. By studying HLA genes like DQ8 and DR13, researchers aim to predict CRPS risk and develop treatments to ease its tormenting pain. Personalized therapies could one day calm the immune system's overdrive, offering relief from both physical and emotional trauma. The road is long, but hope is growing. CRPS is a traumatic, painful journey, but genetic research lights the way forward. With every discovery, we move closer to helping those who endure this condition. Thank you for watching, and let's keep...
Okay, yeah, so that's just a little bit of information. Hopefully, gives some people a better idea of what it is and what we're talking about today. So, Jonathan, do you want to tell us a little bit more about it? And, does that sort of resonate with you, that little video there? It's like, how does that
for sure. So,
really compare?
Yeah, so a lot of the symptoms are widespread. So you probably listen to words like that, like dystonia, or autonomic nervous system dysfunction, central nervous system sensitization, everything like that. So it does make sense, and it's something to do with the role of the glial cells, which are related to the spinal cord as well. So there's two types of CRPS. There's type 1 and type 2. type 1 is effectively similar to what you'd consider type 1 diabetes, in that people generally tend to be born with it. Type 2 is something which is an affliction as a result of a surgery or an injury later in life. So I believe I've got type 2 based on, what I was diagnosed with. So to basically get the diagnosis, you have to go through a number of different. It's a bit like fibromyalgia, chronic fatigue syndrome. So you go through denomination. So it's not that. It's not that. We looked at the body, done the scans, did the blood test, did the lot. Very extensive, in-depth kind of review of my body as it stands. So I had a multidisciplinary team. So I'm not just one expert, but several experts in regards to this sort of thing, who diagnosed me. So that would include things like orthopedic surgeons, neurosurgeons, things like that. And it's a long story short, it's a disproportionate pain response to external stimuli, and that's just not limited to the touch side of things. I'm in a weird position where I'm not getting the support I need. The pain clinics are dreadful. So basically, the longer this goes on for, that I'm untreated or uncared for, symptoms aren't managed, the worse it will get. It's not something you can plug a gap with a supplement. I can't go to Mexico and spend 30 grand on stem cell treatment. It doesn't fix itself. That's been my experience speaking to people online, real people like me out there in the world that live with CRPS. I actually spoke with a young lady, maybe, I think, not yesterday, the day before, and she's an amputee with CRPS. Also, she experienced things like phantom pain right now, but she doesn't compare the pain to CRPS, even remotely close. So the pain level is extraordinary. You do get better at managing things. So over time, you sort of apply the biohacks like Bart K up on the screen here would sort of suggest, things like that, and they take you so far, but they don't plug the gaps in terms of the symptoms. Being complex, regional pain syndrome, it's complex. It's not something we can treat with a drug. The best bet when I was diagnosed was symptom management, and that matches very closely across the board with everyone I've spoken to online with CRPS, or any sort of book I've read. Unfortunately, there are people out there who have sent me messages and Instagrams and things like that, sort of saying, you need to do this, you need to do that, and it's like they don't understand the pathology of it. Therefore, I can't take their advice. A lot of their advice has actually caused me pain, suffering, and a massive, massive financial burden. A lot of the expenses I have are spent on biohacks. Trying to live a bit better, just feel a bit more normal. But my sort of standpoint now is, how do I get out of a situation where I'm experiencing more pain because of my environment? It is truly dreadful. It is abysmal what I'm going through. That's the long story short of it. But the symptoms include things like numb legs. When I say numb, I mean like to the point where I'm using a stick now to get around, and I have to keep looking at my feet to sort of say, yeah, that leg, that leg, that leg. So you lose your sense of rhythm, your sense of purpose in life, your sense of strength, ability, coordination, things like that. I've got wounds on my shoulder and arm, which I'll just show you. So this is a result of clinical negligence, basically, where I had a muscle tear on my medial deltoid head across here, across the medial deltoid head. That basically caused an abscess to form below it, like a sac to heal that medial deltoid tear. I didn't even know I had it, so it wasn't until I had the scan and noticed the abscess. Then, long story short, the abscess got bigger. I wasn't getting the care I needed. Wanted to go to hospital, I couldn't. Wasn't taken there. Basically, I then had the surgery, which is this bicep one here on the side of my arm, because that was left untended for a very long time. I didn't get the wound care checks I needed. So I'm not saying I can control. I'm not a nurse. It's not my strongest arm, so I can't treat it. I can't put gauzes in it. I can't do all this stuff. I can't sew things up, patch things. Basically, because that happened, I didn't get any critical wound care that I needed. I got a staph infection. Now, that staph infection went up into my shoulder, which meant I needed an additional surgery, maybe 2 to 3 months later, to remove that. And that shoulder had roughly a Costa cup full of pus. So that's where I'm currently at. And my initial thought was, I'm on the carnivore diet, I'm doing all the biohacks and things, I should heal quickly. And it started to piece together more and more. So I started to realize, okay, the CRPS thing, it's not just an off the cuff diagnosis, it's a quite a debilitating disease, illness. In that information in terms of my blood markers could be zero, but I'll still experience like delayed healing. So what would usually take maybe 4 weeks to heal is taking me this long. So this is the top wound here, you can kind of see. So that was about an inch deep, roughly a month and a half to 2 months ago, and it's still not healed over. So I'm at the point where it's like, what do I do? So I've now got 2 giant scars on my arm, 2 scars on my lower back. I'm getting bruising, discoloration, and that's just the physical presentation, not the pain side of it. The emotional side, the trauma of going through these surgeries, and waking up the other side thinking, now I've got to take antibiotics, I've got to take these additional drugs which are deleterious and they wreck your guts, as we know. So does that kind of outline it quite well? Or
Yeah, quite well. Yeah. Yeah, I understand. Like constant pain for years on end, it wears you down, man. It wears you down. Yeah. Um, so I mean, you were talking about the young girl. She was an amputee with CRPS. Um, this sort of resonate like resides in certain joints, but your CRPS is in your hips and back as well. Yeah.
yeah, so it's my lower back and hips. So initially it's usually this will say you have a spine fusion surgery, and in a certain proportion of patients, usually it will cause uh, disc vertebrae slips and damage further up down the line eventually, because you take away one bit, you place it with another bit up the line goes down, or down the line sometimes. But
Yeah.
in my case, it's not that. As in, I've had the MRIs, the X-rays, and my surgery is, I mean, it wasn't ideal. Um,
Yeah.
since that surgery, I've actually had a numb left arm for a long time. Manageable, but it's getting worse. So that's where I'm currently at in regards to that. But it's with you said about the amputation. It's not like I can, even if the amputation was a good idea, I couldn't have my hips and spine amputated.
No.
It's not going to work.
No.
So it's I'm quite unfortunate in that sense, in that most cards are off the table. Even a spinal cord stimulator that could trigger worse symptomology of my spinal condition, CRPS, because CRPS is triggered by surgery. So now I'm at a point where it's like, well, how do I manage symptoms best I can, whilst not do the contraindicated things that will damage me downstream.
Yeah. Right. So, like, we've started a fundraiser, this Give Send Go page. Where we started that this week. How does this money help you survive, like just day to day living?
Yeah, so I work as best as I can, doing things like coaching, and I do have a good roster of clients, but the money only goes so far. And I'm sure anyone listening to this will know, when you've got limited capacity to work, limited capacity to earn money, just to live your day-to-day life socially, it becomes an absolute torment and drain. So I'm getting a lot of advice saying, buy this, buy that, do this, and like, I've tried it all. Like every penny I've had, like spare. I buy the odd luxury, like I don't know, this lovely T-shirt. That's about it. It's not like I
Yeah.
can go to the cinema or go traveling to New Zealand to see Bart and Pim, or go to a theme park, or even going to a cinema is hell. So if I go to cinema, I'm bringing a pillow, a cushion to sit on. Make sure I get the reclined seats, so that adds to the burden. Then I've got to find a way to get there that will involve less pain. So if I had to get the bus there, I can't just sit on the bus. I have to be on a position which is sat forward, so I don't twist and spin and go around roundabouts. If I get an Uber somewhere, I've got to sort of make a special request. Please drive very carefully. I have a spine condition, and even then, they drive like Mario. They drive like
Yeah.
absolute lunatics around here. So if I'm being shook about in a car, it's painful. It hurts. And I was on a bus recently. This lovely old lady sat next to me. I sat near the front, and I was just looking at my legs, and especially my right side seems to be most affected. She like just tapped me just like that, just with her leg, just going around the roundabout. I felt like I was being shot. And I was like, I can see with my own 2 eyes that this lady has not tried to harm me, but it feels like she has.
Yeah.
And it's like, so I'm doing all the things I'm meant to be doing in terms of like, I've had NLP, hypnotherapy, psychotherapy stuff, CBT, pain management courses, all that sort of thing. And it only goes so far. So where the money is basically going to is to keep me going. So that means healing peptides to manage symptoms like the discoloration of my hip. So like where the skin's not healing properly, so things like that, BBC 157, TB 500, keeping chronic inflammation lower. So that means I've got to follow a proper diet. I can't eat the duck food, as our friend Richard Rodriguez would say. And if I do, that would cause a massive, massive flare up. So I use things like medical cannabis as well, which I'm prescribed, which has probably been the most helpful thing out of everything I've tried. So there's my prescription anyway. But this single bottle, which is, I want to say it's like maybe 100 mil. No, sorry, it's 30 mil. Costs about £100 or 120 US dollars, and I'm paying that every single month. And that's just one medication. I've got to manage it with other things as well. I'm not getting support from the pain clinic at all. They've lost forms. They've been absolutely dire. As in, I've just been left to rot. So the healthcare system over here has not been fruitful or helpful to me at all, which is why I've had to reach out, because it's got too much. And there's other things going on in the family as well. So mental health issues. My stepmom was diagnosed 3 or 4 weeks ago with endometrial cancer, and it's spreading fast. My brother's having a baby in a few days, so everyone's bandwidth is totally spent. And unfortunately, I'm the black sheep of the family, so I've been forgotten about. That's basically it. I've asked for help, screamed for help, cried for help. It's not come. It's just been, I've been left. So I've reached out to people like you, people that have a bit of empathy, So that's where I'm at right now. So yeah, the money's being spent sensibly on stuff that I do need, which I'd otherwise be spending my own money on if I could earn it to that capacity. So
yeah, you're right. I mean, limited work capacity means limited income as well. So it makes it very difficult, especially when you have expensive medications. And that, like you said, that's only one medication.
It's the supplements as well. Some of the supplements I take and I find a benefit. Because I take them, then I don't take them. I'm like, okay, I noticed a change here. But they only work very minimally. When you've got an optimized diet, pretty much it only goes so far. So sometimes it's hard to work out what's good and what's bad. Then of course you get shills and charlatans on the internet sort of saying buy this, buy that, and it's like, no guys, essential oils is not going to fix my pain. No, eating, I don't know, raw meat is not going to fix my pain. I'm sorry, but it's not. It's not going to make a difference. It's a physical issue, which is as you mentioned in the genetic testing side of things, like the HLA, whatever it was. It's immunological, neuropathic. It's been, there's lots of mechanisms which underpin my pain, so it can be measured in some sense or proven. The problem is you can't treat it. So my best bet is symptom management. That's just what I'm trying to get at. And with my best efforts right now, I can keep my pain at about an 8 out of 10, like baseline.
Yeah, that's right. I mean, you can, like the video said, it's like there are like genetic sort of markers that you can like diagnose this sort of stuff, but there's nothing to actually treat it or manage it. Like you really just have to find what works best for you. So I think that makes it a real struggle. It's one of those things that there's no cure for. I just hit
one of those few people where the carnivore diet doesn't fix it. It's not like diabetes or asthma where you can, kind of get a bit better. That's it,
Yeah. Like you said, it's more about management, isn't it? So I'll just have a look at some of these comments. I mean, Bart or him may want to add something to that, or
yes. First of all, as a friend of the channel, as a friend in real life, even though we've not met in real life, but we know how it goes. I hate to see what you're going through and what you're experiencing. And I would like to encourage all my folks to do whatever they can do. Because the NHS is not supplying you with what you need. The support you need is not forthcoming from anywhere. and all of this is costing. So yeah, guys, let's help out, basically. I don't know what else I can add at this point. Probably not much at this point, other than we're simulcasting on the channel to get the word out there. So, you know, if you're watching on my channel, absolutely feel free to super chat there, and we'll make sure it goes where it should go, and we won't take 30% out of it like YouTube does. So we'll pay that ourselves. I've just unilaterally decided. Well, I say I've unilaterally decided, but if Ted was here, he'd agree with me, wouldn't he?
Yeah, I'm sure he would.
Yeah, Ted has not been seen at the camouflage training.
No, he's always very good
Queen
at
of Pirates, you're very quiet down there.
Yes, I had to find the unmute button. Yeah, I'm just speechless. It's awful condition, and I can't even imagine what you're going through, basically. So
I think the biggest thing there is that you don't get any support. I mean, it's really difficult when you don't have support around you. You know, and I understand, you know, family life and things like that. You know, I won't go into that with my side of things either, because that's another whole other topic. But you know, when you don't have the medical support either, like the NIH or was it NHS, or it's in the UK, they just leave you to rot. Basically, what I mean, when you get to a point where they figure that you are untreatable, they basically just ignore you. You know, and it's the same as the system here. You know, you get to a certain point, and they figure, well, there's nothing we can do, so you know, you're on your own, sort of thing, and that makes it really difficult. Like you say, like you have to pay for these medications for yourself out of pocket. You don't get any sort of discounts or anything like that. These are, you know, very expensive stuff, especially when you're talking about, you know, this is for the rest of your life, perhaps. You know, every week you have to come up with more money to try and, you know, fund this. You know, it's a terrible situation to be in for anyone. You know, so anything that we can do to help, I think, is, you know, this is where hopefully people will understand that this will help to actually keep you going. Because it's like hitting a brick wall when you're in situations like that. You don't see a way out. It's hard. It's tough. So, and I think the fact that you are still working, are still trying to help people, still making videos, still giving nutritional advice, pretty much most of it for free, is incredible. So, I mean, you're a true champion. You know, really. So let's have a look at some of these comments. Sorry, mate. You're right.
Yeah, go for it. Have a read through. I've not seen them yet because I'm on my phone, and that's the other limitation I have, is recording video. So in front of me, I've got maybe, let's say, £2,000 worth of recording equipment. My friend's actually Matthew. I think he's in the chat right now. Thank you, Matthew. He sent a lot of that stuff to me to help me record. And I've used it as best I can. But the thing is, it's now having to like do a lot of recordings either from my phone or through my my setup, which is my studio, is basically the end of my bed. I can't even. I've got 2 ergonomic chairs in my bedroom which I can't use. I can sit on them for 10-15 minutes. I can't do a consult in them anymore. You know, it's too hard to just sit there. So there's a lot of limitations. When you spend 20+ hours a day lying down, when you're doing your best to sort of try and earn money, and it just, like I said, that blockade is just constantly there, and it doesn't stop. It doesn't live down. And yeah, some days I have better days. You know, some days I'm like, I walk around the house a little bit quicker. You know, there'll be a old lady who's getting off the bus, and I'll keep up with her, and I'm well chuffed. I've got my nan who lives downstairs with us, and she's 94 years old. Pretty healthy, if I'm honest. She can stand there with one arm, you know, put her shoes on, sort of thing, and it's incredible what she can do. And she walks twice as fast as me. So it's not just like, obviously it's the money side of it, but it's also the time side of it. Things just take longer. Like if I'm on the toilet, if I'm getting up out of bed, use like a lever arm here that I'm resting on, sort of thing. Things just take so much longer. So I'm trying to learn to be patient. And when you're dealing with like social media and stuff like that, and you're trying to put your best foot forward and, you know, give something back, you know, we're all here for a purpose. But if you want to give something back, sometimes you can't do that. That's what kills me.
Yeah, it's frustrating. You just want to do something. You want to get off the bed, and you want to just do something. Anything would feel better than lying in bed for 20 hours a day. That's incredibly frustrating, and I understand that completely. There's nothing worse than staring at the ceiling all day. Drives you nuts. Yeah.
Got some super chat action going on there.
Got a few there. I'll catch up with that. We've got HLA DQ8 is also associated with gluten sensitivity and celiac disease. Well, that's it's good information, but I think you don't partake in anything with gluten in it or anything like that, do you?
Yeah, it was actually I don't know if you may have heard this, but it's Harry kind of brought that part of it up to me. I think yesterday or today. Basically, what I need to do is prove how the mechanisms work. If I have this gene that's associated that closely, it gives me more leverage down the line. So if I need to sort of go to more extreme circumstances to get the help I need, I can. So the sort of things I'll be paying for, like genetic testing, live blood, whatever it is I have to do to sort of put myself forward to get in a better position. That's what I'm trying to do. That's what I want to spend money on. So I'm not like this.
Yeah, that's another thing too. Getting all these tests and just trying to research more of this stuff, that all costs money as well. It's not like the hospital system is trying to find out what how to actually help more. They're really just there to, well, if they are there, they're really just there to try and dose you up on some more painkillers, really, aren't they? Okay, if there's a form of did I say tonomia? Okay, Mary Ruddock is known to help.
Dysautonomia is one symptom of many which I experience.
Okay. Yeah. So Mary Ruddock is known to help people with that. Might be worth trying to work with her. Is that someone you know of, Mary Ruddock? Maybe write that down for later.
I can put you in touch with Mary if you did want to talk to her.
That'd be helpful, yeah. If she knows something I don't, that'd be really good.
Yeah, I suspect, Jonathan, that you have done all the research into this that there is on this condition, because I've had a quick look and there's fuck all that you can look at. So I would suspect you're probably a world expert.
Within hours or minutes, yeah, most people could be.
Yeah. But anyway, we can certainly talk to Mary and see if there's something she knows about it. I'll ask her in the background. Let you know.
Thank you.
That's great help.
Yeah,
you never know. Like you said too, but like there's screw all bloody research on this sort of thing too, like and that's a big problem, isn't it? I mean, no one's doing enough research on this because it's quite rare, obviously, but still, people need to know about it. Massive respect to Jonathan. Yeah, absolutely. What he's going through, and it's see, this is the thing too. I mean, most people can relate to pain in general, but when it's a constant pain, like 24 hours a day for years on end, and who knows for how long this might last for Jonathan, hopefully not his whole life. That's the big struggle. Like everyone goes through pain in short term, but not a constant sort of thing like this. Thanks for all your help, guys.
Let's keep the super chat action rolling in, folks. Let's keep it rolling in. As it were, I've said I'm up for 30%, so make it fucking hurt.
Yeah, that's right.
All right,
yeah,
people, make me pay a ton. Get it rolling. Let's go.
Alternatively, you can also go to the Give Send Go link at the bottom of the screen that's now scrolling across the screen. It is free. They don't take any percentage of this from Give Send Go. So, Jonathan will get more of your donations from that link, which will, go a lot further. So, and certainly, hopefully will help him to, one, get these tests done and to keep these painkillers and other medications coming in for him to help just at least try and make his life a little bit more comfortable and a little bit more manageable.
Yeah, for sure. I
It's
just want to
also
say
good
thank you so far to people that have donated. So I've actually compiled a list as best as I can. Some of the people are anonymous, but I've managed to find their email and stuff like that. I could go through the list. It would take me quite a long time, but I appreciate every single one of them. So imagine I've got a big burger patty here. Everyone's a slice of that. And it all counts. It all makes a difference. If I one day wanted to sit at the chair sort of thing, and I've got to do a live stream, that's about £4, $5 in medication just to do that. So everything you're doing does directly help. It actually does go somewhere. It's not. You're not pissing in the wind. I'm not spending it on crap. So,
yeah. That's a good point too. Like helping to keep Jonathan going also helps him to bring out more videos or more information for you as well. So it's not like you get nothing for it. You're really helping someone out who's helping a lot of other people. So thanks everyone for supporting Jonathan and helping him along the way, because it does make a big difference to it. Like emotionally, knowing that people are out there trying to help as well. And you're not alone. You're not stuck in bed, and you're not the only one. There in. It really does make a difference. Hi, Jonathan.
yeah,
I
even
wish I
people
could
just
do
saying "How
more.
can I help?" goes a long way. Like I
Yeah,
spoke with you all three people on the screen right now. Well, not me, but um, everyone said, "How can I help?"
yeah,
People don't say that to me. They just expect me to suffer. I've not
yeah,
been off. I've not been asked, "Oh, what can I do for you?" No one's really said that. So that's for me. That's unique. People the other side of this fucking ball are trying to help me out.
yeah,
That goes a long way.
yeah. Well, it does, and we all try to do our best. There's not a lot that we can do other than what we are doing, but at least we're trying, and that's the point, that can really go a long way, I think. John, thank you, mate. €50, is it? Well done. Great support. Hi, Jonathan. I wish I could do more, but I hope this helps. Stay strong, and greetings from Belgium. Yeah, good on you, man. Excellent. Yeah, absolutely. They say untreatable. Left isolated. It's scary. Yeah, it is scary. It's that when you're faced with a situation where you just don't think that there's a way out, it can be very scary. It can be, a real, it can be a lot. I've had sciatica for years, not comparable, obviously, but that helps with my inflammation and mental state. Do you ever use them? Good luck, mate. I'm not sure whether maybe that's the second part of something, but I'm not sure where the first part is that. But thanks for the super sticker anyway, or the super chat. Yeah, really appreciate it, guys. I know Jonathan's probably, like Bart said, Jonathan's probably an expert on this stuff anyway, but you never know. There might be something that you don't know about yet.
Yeah, there'll be something. I know Harry's looking behind the scenes at different genetics and his sort of field of expertise. So that will go a long way. But there's not many of us. There's not many of us. Like for example, if we look at the stats that we apparently have, it's 100,000 people, and maybe 20 of them have it. 100,000 people. Even less of that proportion are men, and even less of a proportion of that have it in their spine and hips. So it's although like Bart said earlier, although the expertise and knowledge and research is that small, for me it's even smaller. Where do I go from here? So it's a constant bottleneck. But if anyone has like a good inkling, which is something more than essential oils and glucosamine sulfate, fuck me, that'll go a long way. So
Yeah.
I have tried most supplements, for anyone wondering, just so you guys know.
Yeah. Okay. Just to go with that message, the super chat there before, the sauna helps with the sciatica. I'm not sure how that. I mean, you never know. That might help. with pain management. But saunas are a pretty expensive bit of equipment too.
Yeah, that's right. Those sort of things can be sort of like a warm bath, can be for a warm shower. I've had some adaptations made to the house yesterday and maybe a few weeks prior, so that helps a bit. But the issue is because it's like I said earlier, it's like fibro or something, or chronic fatigue. It's almost like a syndrome, but we can underpin the mechanisms. The problem is it's so complex that, say I have a sauna in my house, I use it. Is that just treating the muscular side of it, like the odd pain I get here and there, or is that treating the nerve side of it? So sussing that one out is another minefield. So you sort of almost become a bit of a hypochondriac because you're like, my body's doing this, is that a symptom of that? And it could be a solarium thing. So getting the right tests done down the line will be quite useful, I think.
Yeah, that's one of the big struggles, isn't it? Because you feel something niggling or something going on, and you think, okay, where's that starting point? Where's that coming from? And it's like, well, how do you test against that? Without doing 20 different tests. So yeah, that can be a struggle. So I don't know. Anything you guys would like to add to this? Any questions, Bart or Pim?
Not from me. I'm just here to tell people to get your bloody wallets out, frankly.
Yeah.
I'll be getting mine out later. But in the meantime, we're here to get a job done. So let's get that job done, please, for goodness sake. Jonathan has offered of himself freely for months and months and years on end and asked for nothing in return. He's given a bunch of really good free information out. And he's been a real friend to us here in the community, really, and a real asset. So let's back him.
Yeah, that's a good point. He's been a great asset for the carnivore movement, but not just that. Like, people's health in general. Like, you have a look at his channel; it's full of information that you just don't get on very many channels. Even though there's a lot of carnivore channels out there, there's not many as qualified and real good information, except for people like Bart, of course, Pim, and of course Jonathan. So any support that you can give him is going to keep that information going.
It's the Norwegian Jonathan. He's a good guy. If anyone's following me or Bart, I suggest following him. He's got a great sense of humor and a real true supporter and honest bloke. So follow him if you haven't yet already.
Awesome. Ooh, Johnny Wong. Hey?
Yeah, thank you. 100 NOK. Not real sure what the NOK is. Norse.
Oh, Norwegian Kronor, that would be.
There we go.
Yeah. But
well done. Thanks very much.
Let's move on to Johnny Wong's $200.
Johnny Wong, you're the man. That's awesome, man. Thanks, man. Thanks, brother. Really appreciate it.
Appreciate that. That's a lot of money, yeah.
I've got a question. Would an infrared sauna heat blanket help? Not a bad question.
It's not a bad question. I've got a red light therapy panel next to me. It's also got near infrared as well. Probably one of my symptoms is extreme heat. So a few months back, maybe 2 months back, I actually went to the shed at the back of the house and slept on like a fishing bed, basically, because I was so hot. So that's one way I know I'm going to anticipate a major flare-up if I start to get really hot. So I sleep. I'm actually wearing a t-shirt now, but I tend to sleep wearing just boxers with the aircon set at 16 degrees Celsius, and I've got a fan right there, if you see what I mean. So the heat is absurd. So I can't use a lot of these things frequently or often, just because they could trigger some sort of flare-up, in my opinion. Things like that are helpful. So I do use the panel for limited times on, say, like my lower back or something, or my hips. I'll just lie on it basically for like when I'm eating dinner. I've got a vagal nerve stimulator thing as well. How much efficacy it has, I don't know. But, effectively, I think I've shown you see already, but I got sent this a while ago. Basically, it's got loads of biohack stuff. It's an earpiece thing like that. Goes around my ear.
Yeah.
It's got a panel. It basically emits like an electrical current on the tragus of your ear, and it's meant to stimulate vagal tone or something. So
Okay.
yeah, I'm doing a lot.
So that you're talking about, when you've got a flare up coming, you get like really hot. Your body temperature gets really hot. So so I'm guessing that if you sat in a sauna, that might actually cause a flare up. Then, do you think?
It can do, yeah. Generally, it's more helpful than not, but I just have to limit exposures. So I'm like an iceman all day. You could come into my room, you would be cold. You'd want to put a jumper on. I sit here and I'm like, I feel about right now. A bit colder might be better, but you know. So.
Yeah. So have you? I mean, silly question. I guess you've probably already tried things like ice baths and things like that as well. Yeah.
Yeah, so they tend to stress me out quite a lot. In that I start to get issues where I can't recognize if I'm getting too cold or not.
Yeah.
So with the central nervous system being dysregulated, you might put, say, an ice pack on my foot, and I'll have sweaty feet, like sweat dripping off my feet, but my feet will be cold to touch. It's insane. So it's the feedback response I'm not getting, so it could be quite dangerous in some aspects. I wouldn't want to be inside an ice bath on my own, drowning, but things like that could be useful. But sometimes it's a case of just running cold water over my hands. So I use a lot of distractions, chewing gum, vaping, all the things I'm not meant to do, just to get me through the day. It's like a distraction. Like people take up vices because it helps them. So I try to use the minimally damaging ones and don't turn to alcohol, things like that. So
yeah, it's really, it's really difficult to distract yourself when you're stuck in bed for 20 hours a day staring at a ceiling. So you end up taking up these different things to, like you said, like the vaping and other things that you probably shouldn't be doing. That I mean, what else are you going to do except think about things when you're stuck in bed all day? It's crazy. The only thing that helped my sciatica problem, we just lost Jonathan. I think he'll be back in a minute. The only thing that helped my sciatica problem was acupuncture with proper specialist. There's a bunch of bad ones out there too. Yeah, I'm not sure. I mean, have you ever tried acupuncture, Jonathan? I'm not so sure this has really helped, but you never know.
yes, I one of my friends, actually, Brett, she's an IFBB professional wellness bodybuilder. She does sports massage therapy, things like acupuncture. We tried that once and it was effective. So I had a bit of a flare up. Basically, I ate the duck food, my bad, and it looked like my legs probably got 4 to 5 inches bigger. And she used that, and the next day the swelling gone down by about half. The day after that, it was gone. So that sort of thing could be useful. A lot of the problem is accessing things. So although say there was a world expert in microdiscing in Bournemouth, the city or town area that I live in that area, well, I've got to get there. It means I've got to get the transport there. It means I've got to buy the pain meds to be able to sit on the bus to get there, or the Uber.
Plus, you got to pay for the treatment as well. Like even if you could do acupuncture every day, sort of thing, there's a large cost involved in doing this stuff. So, I mean, it's great to have these ideas and these things out there, but like you said, accessibility is a big problem. This why we're here. So
my best bet is the online community for this kind of support and help. I've got a friend, for example. He had to move house a while ago to sort of make it more livable, manageable for my nan, because she had to move out of her house. My friend, anyway, he's got a HBOT, hyperbaric oxygen therapy chamber, and he said I can use it anytime I want. Problem is, for me to get there, £60 British there and back, maybe 50. and even the free help I have to pay for is in to get that.
Yeah.
So that's where the limitations lie. So people are out there trying to help me, but getting there is most of the problem.
Yeah, that's right. Yeah. Yeah, unfortunately, when it comes to, especially when you're stuck in bed, it costs money for transport, even just to get to, like you said, free treatments, things like that. But every little. So this is why every little bit helps. Even if you can give like just a couple of dollars, all these things help. Yeah, this common grounding bed sheets can help. I think Jonathan's already got all this sort of stuff going. Like you said before, he's got all these different hacks. He's been doing all of these things for a long time, actually. And I think you do like 5 or 6 different hacks even before you get out of bed, right?
Yeah, so I do that ear thing I was showing you earlier. Red light therapy panel. I take some supplements as well, so like Pamitol, ethanol, amide. I don't know. It's one of the most effective apparent supplements for CRPS, nerve pain. Then I use medical cannabis. There's different types, different strains, different amounts of potency. So I have to use certain ones sometimes. So it's not just one medication I've got to take. Red light therapy panel. And if I'm up early, like I was, I think this morning, I'm checking on like the blue blocking glasses. Daytime, if my eyes are strained as well, I'm starting to get some pain in my eyes sometimes. It could just be the screen time. I'll be using like the yellow versions. What else? Nicotine gum. So that's got some ACE2 effect in the body. So that's meant to help with pain as well. So chewing gum is a biohack for me, oddly enough. Distraction. Helps me pace myself when I walk as well. So it gives me that chew, walk, I do some sort of things like mindfulness. On top of that, I've got creams to put on my body each day. Like I'm using antibiotic cream at the moment for my hip stuff. There's more here than what I can think of, basically.
This brings up a good subject, actually. Just waking up, checking into the show, nice support. Thank you, Juliet. Really appreciate that contribution. So like with this pain going on, like what's your sleep patterns like? Because that makes a big difference too to how you feel.
Yeah, so I track everything on bodybuilders nowadays are quite refined with their approach, and we use a very scientific kind of method. So I track everything my body does in a day. I track. It doesn't mean that I'm saying that every metric I use is absolutely accurate, like these sleep watches and smart watch. They're not absolutely accurate, but if it's a number I can track and look at a trend, I try to do it. So in that kind of regard, what was the question again? Sorry.
I was just wondering what your sleep patterns are like because of all the pain. I know it makes it very difficult to sleep.
Yes, I can get a full night's sleep, but it means the next day I'm intoxicated with medication, which means I'm not productive that day, which means I'm not making videos, which means I'm not socializing, which means I'm irritable, which means I'm hard to deal with. So I avoid doing that as much as possible until I need an absolute reset. But yeah, my sleep is typically broken up into, at the moment, 3 different parts. So I might crash out after the medication at maybe 10 till 1. Then again, maybe 2 till 4, maybe. Then if I'm very lucky, I might get an extra hour in at the end. So sleep at the moment is poor. It's not great. I might get up until maybe a month ago where I got an aircon installed in my room, maybe 3 or 4 hours a night. And I was doing it for a long, long time. And I mean, that was on average. It wasn't like I was getting 3 or 4 hours a night a few times a week. It was on average, that was my baseline level. And it ages you, it's almost debilitating, that side of it, when you're sat there, people that from school, like, oh yeah, you look a bit older. It's like, thanks for that. Like, yeah, I know pain. I know not sleeping makes you look old. So does not having children, but I don't tell you that.
Yeah, that's right. Yeah. No, it's a real struggle to get sleep when you're in constant pain like that. So, but it's one of those catch-22 sort of things. Sleep does help with everything, but what can you do? I mean, you're in pain, and it keeps you awake. Yeah. Consider progesterone. It's not just for women. Men benefit too with pain relief, sleep, and recovery by reducing inflammation, balancing hormones, and regulating cortisol, all with minimal downsides. What do you think of this? I mean, thanks for the contribution, guys. I really appreciate that.
Thank you, yeah.
But I don't know. What do you think about that, Professor K or Tim?
I'd be interested in Professor K's opinion, which would probably be the same as mine.
Okay.
Yeah, I'm just not sure that there's any evidence that would back up that version around progesterone and pain, really. Pain is a very subjective experience.
Yeah.
And it's also a very individual lived experience. So, yeah, while we do thank you very much for the Super Chat action, and guys, do absolutely keep the Super Chat action rolling in. What else can we say? Pim and I sadly have a thing to do at the top of the hour, so if we want to get Pim's opinion, we better get that pretty much soon, hadn't we?
I don't know enough about it, to be honest, to make a comment about it, to be fair.
Okay.
I'm just thinking that Jonathan's condition is not like any other pain condition in general. It's just a big generalization. It's not caused by what normally causes pain. So I think, whereas a lot of these suggestions might be very helpful for most people, I think, I mean, by all means, keep a list of everything and do some research, but I have a feeling that a lot of it is not going to work because it doesn't have the same origin. So whether progesterone works for other people or not, not convinced that it might be the solution. But I mean, if it was me, I would do some research. I would probably try pretty much anything to deal with it. So
yeah, that's the thing too, isn't it? Yeah, this is the one of the benefits of doing something like this too is that, yeah, we get a lot of ideas, and like Tim says, if you're in this situation, you try anything and everything. You really do your best to test everything along the way. But again, to do that, it costs money. It costs a lot of money to test everything, to try all these things, even just to, like Jonathan was saying before, like just transport to get to these places as well. It's all very expensive. So anything that you guys can help with, like any sort of, financial, only has to be a couple of dollars. Every little bit helps. And I'll show you. I just want to show you the page you can go to help Jonathan and donate. Now, this is Give Send Go. They don't take any cut. This is so like YouTube takes 30% or so. So this is an alternative for you to go, and every cent that you give to Jonathan's page will go to Jonathan here. So this will really help. It tells you a little bit about his situation as well. Okay, so you can check this out. And if the link is scrolling across the screen at the moment, but it's also in the description. You can just click on the link and go and make a donation there for him as well. Okay.
Right. With that said, all the best, Jonathan. I really, really hope things get better for you and soon. Let me know if there's anything I can do. In terms of what we should all do, which is get our fucking wallets out. I will be doing that later, and we'll be sending across the funds from my live stream with a little bit extra with love from Pim and myself. Sadly, we do have to race off and do stuffs because we're busy people, but we just wanted to show our support. We wanted to drop and show our faces and say, guys, come on, let's get behind Jonathan here. He needs us. He's given us a lot and he's asked for nothing. So there it is. All right.
Excellent. Thanks very much for joining us, Tim. And
all right.
Your timing's awesome. Appreciate it, Bob. Thank you.
No, pleasure, Jonathan. Anytime, mate, and twice on Sundays. All right, guys. Love you all, and there's nothing you can do about it.
Yes.
Yeah.
Excellent. Okay, so I just want to remind people too, this is Jonathan's page on YouTube, Carnivore Muscle. Okay. Now he is still competing. Like even in this situation that he is in now, with this constant pain, and that in itself is an incredible story, quite inspiring. But look at the information he gives you for free as well. Like all these videos that he makes, teaching people how all these different mechanisms on nutrition and everything else that he does. Okay, this is information he gives to people for free. All right, but this isn't free for him either. This costs money. Making videos on YouTube costs all of us creators. It costs us a good deal of money, and it's very, very time consuming. Okay, there's something that people don't appreciate, and he's doing all this for free.
Yeah, I mean, even the stuff which I've charged people for like my ebooks, I've made it into a video audio ebook that you've scrolled past it. I've put it into like 6 sections. That took me and my friend Jerome Armstrong a long time to write out. Maybe 100, 200 hours went into putting that together. I've given it out for free, and I think the best thing anyone can do really is obviously like the video, leave a pleasant comment or some sort of support. Also things like sharing the video or sharing the link to the Give Send Go. That typically actually yields statistically more for me to actually benefit from in terms of like my long-term health than like a $10 super chat, for example. So just sharing the link across like co-workers, friends, family will go a long way. And as a collective, I'm sure we can sort of bind together so I can keep going,
Yeah. That again, that would help as well. If you can't make even a small donation, it costs you nothing to share a video and to give it a like. And this will also help Jonathan's channel out a bit with algorithms and things like that as well. And like you said, like he has these fantastic ebooks. One that I bought myself, the Guide to Bodybuilding and so on. That he also put into videos for you to get for free. But even the books themselves are dead cheap. It's like $12 Australian for his large
even less. Yeah, something like that.
Yeah, like, and it's 170 pages. It's not like the ebooks that you get from most people, where maybe 5 to 10 pages of fluff that actually tell you nothing. All right, this is a comprehensive guide on nutrition and bodybuilding and things like that too. So it's really worth taking the time, and like $10 anyway, get yourself a really good ebook. It's worth it. Absolutely worth it, and it will really help him out. And it's something that he put a lot of work into. Him and his mate, they did this. It took them over a year and a half, I think it was. Is that right? To make this ebook. Right? Think about $10 for like a year and a half's work. Okay, not to mention the years of education that it took him to get to that. All right, so basically 6 years worth of work you're getting for $10. How can you complain about that? So
yeah. I'm not here. If anyone's listening to this, I'm not here to sort of say fund my life so I don't have to do stuff anymore. I want to do more. I want to work. I'm here to provide and help how I can. I don't have all the answers. I'm not Professor Bart. I mean, Bart K wouldn't say, but I don't have all the answers. Bart has pretty much most of them. But what I do have, I want to share. I don't want to dwindle away and squander what I've learned over the years. And if I go to the gym all the time, I see people just failing every year and doing the same thing. I can see where they're going wrong, and I'm like, oh, if you could just watch a few of my videos, go to the playlists, scroll through, you'd find the answer you need. Like you said, the ebook does provide a comprehensive look at even just starting the carnivore diet, a few recipes, a few testimonials, people that I recommend following. What else there? The Randall cycle is explained in there. Intestinal permeability, different protocols, hacks, supplements. It's all in there. So effectively, what I can say to you is, if you are wondering at bodybuilding, outside of me doing the program for you, that's your best bet. And the videos as well, which are free. So I wanted to make a quick mention just well to you, DC, just to say thank you for I know you sent a donation through recently, which I really appreciate. And also you bought the super chat, you've joined my channel as a member. And that's sort of, even like joining the channel as a member, guys, for like 99 pence, I might get 60p out of it, or 70p. That's residual income, which will help me. It goes a long way. So that's, it shows other people, this guy's a valid source of information. Like I said, I don't have all the answers, but I want to help provide as many as I can in the best light possible. The other person I want to make a very important shout out to, Zbigniew, if you're listening, of course, good friend from Poland. Juliet, she's a fellow content creator, so her name's Juliet's Autistic Experience. She popped up on the screen earlier. She's an autistic mum of 3 children with autism and other different health issues and conditions, and she's doing it on her own. So she's an absolute inspiration. There's been nights where I've been lying here crying into this pillow behind me, and she's been there for me. So
yeah, well, that's good. This is another thing that Jonathan is dealing with too, is autism. But we're not here to fund his retirement. We're here to keep him going, keep him creating content, so that we can keep him helping other people. We're not here to try and give him an early retirement. This is not what this is all about. This is we're not just trying to raise money for the hell of it. He needs help to keep this channel going, and I think he's a very valuable source of information. And like you said, doesn't have all the answers, but he's one of those people out there that is trying to find the answers for you. Okay, and that's what we're all doing. I'm doing the same thing, and well, I suppose Bart pretty much does have all the answers, but there's a group of us out there that are still trying to give you as much of the information that we can find that will help you in your journey as well. And Jonathan is one of the better ones out there. So this is what we're trying to do. We're trying to keep him going so that you can get benefit from his experience and his knowledge. Okay.
Thank you. Yeah.
YouTube will not let me share my money with you. Good man. Yeah. Good man. Thanks for that. I really appreciate it. Like, again, the Give Same Go, he gets 100% of that money, so you're not feeding YouTube as well. But every super chat you do get, Bart is also going to help pay the 30% as well. So really appreciate that from Professor Bart. Okay, he's not always the grumpy professor that people think he is. He's a really good guy, Professor Bart. Okay? He's one of the better ones out there.
He's not this. He goes without saying, no one's that mean to people and uses full letter words that often. He just does it as part of the promotion to get people hooked on the information.
That's right. I mean, the problem is too, like Bart says, if he does do a lot of the straight-laced, more straight information sort of videos, no one bloody watches it.
Well, the thing is as well, DC, he has thousands of videos. I mean, he's made all the content anyone in our space could actually need. So now it's anything else is like he'd just be spending all day signposting people to videos if it came to it. It just takes so much time. So like these live Q&As that he offers, it is the best answer that he can give in the context that you give him. So I encourage people to support him as well. He's out there living his best life. He's a beacon of hope for people like me that are autistic, struggling. He's been through fibromyalgia. Not quite the same, but similar in terms of debilitating fatigue and pain and things. So he's someone who's made it. So he's a true inspiration.
He's had his own health issues as well. But like you said, I mean, he's with the other channels that he has as well. He has fantastic informative videos that, again, like he says, people don't sort of watch. So, and like the live Q&As, he gives up his time to do these sort of things. And of course, people have like very short questions. You can't really expect a full diagnosis and like in-depth sort of answers. This is not the way to really converse with people when it comes to serious situations. But You know, you can get consults with him though, and
They're
thoroughly worth.
affordable.
Yeah, they are affordable. Not
I
not
bought
like
them.
unqualified surfer bums that charge you $1,000 an hour to get information that they can't give you anywhere. They have no idea. They're not qualified and so on. Like not a Dr. Salad Boy and so on. But yeah, at least when you ask Bart a question, you're going to get the best answer you can get. So
Yeah.
Are the AI narrated videos doing better compared to your previous voiceovers you did yourself? Just wondering. You go.
That's a good question. Yes, it's a bit of a mixed bag. So I can create the script myself, and I can make adaptations to make it a bit more funny, or use certain wording and things like that. Sometimes I try to make videos that are broader, so you'll know if they're broader, and I'll use keto examples. So on the screen sometimes it'll pick up like almonds. I'm not suggesting people to eat almonds, but for me to go through the videos and like the AI side of it, every single frame of a video and change the pictures of almonds to pictures of steaks, it would take me forever.
Yeah.
You see what I mean? So I'd say largely speaking, it's been quite helpful, but you kind of lose your voice. So you might notice sometimes I'm writing down like from carnivore muscle, because you feel like you lose your identity. People don't, they call me all sorts of funny backwards names, and it's kind of stressful, kind of annoying, because I feel like I'm losing my identity just living in this dome. But my kind of hope is to get back to doing more content, even if it's not just more frequent content. It's just, here's a nice 20-minute video outlining this of me talking to a camera outside or something. That's what my intention is. Thank you, Liv.
Yeah.
Liv has actually, I believe, done another super chat as well at some point, or a donation. So thank you for that.
Yeah, I think so. Yeah. Thanks for that. Really appreciate it. Wishing you all the best, all the well-being, Jonathan. Good man. Good on you. What was it? Yeah, the thing about AI videos too, like when we make these, like we have to make the scripts. We actually have to pay to make these videos. So I know some people get a little bit cheesy when you want us to speak over, but like I find it difficult sometimes to read us to actually speak a script. So like I still have difficulty speaking. Actually, I don't. So I try not to. I try to avoid it when I can, because you have chemotherapy damage, brain damage, and things like that. So I still have trouble with that. So I use it as an easier, more smoother delivery of the knowledge that I have, to try and give you the best experience that you can get with that information.
Yeah, it's
So
it's
that's
bridging
my
a gap,
experience.
isn't it, DC? It's
Yeah.
filling a slot you perhaps aren't quite strong enough or able to at this moment to make.
Yeah, exactly. So that's the reason why I use it. I mean, some people like it, some people don't. But these are things that still it cost money, and it's one of those things that we sort of try and we just do it because we're trying to help people.
Yeah.
Thank you, Hugo, for sending your support to Gifts and Goat. I really appreciate it.
Thank you. Thank you.
Dave, Mac, good on you, mate. Thank you.
I don't know how much it is, but it's got a lot of zeros. Cheers, Dave. I appreciate that a lot. Thank you.
20,000 yen, says Nima, about $200 Australian. So that's good help. Yeah.
Thanks, Dave. That means a lot, honestly. Yeah, if anyone's watching this and they've got a large sort of YouTube channel like Dave, for example, from No Carb Life, great channel, loads of interviews there, great source of inspiration. Share this video, share something that I've posted. It goes a long way,
Yeah, it does. Yeah, it really does. That really helps out Jonathan's channel. Anything that you can, like, it costs you nothing to give a video a like and a share. Share it to Facebook, share it to Twitter, whatever socials that you have. It's not going to cost you anything, but it really helps out Jonathan's channel. And the more he can get from his channel, the more information he can then bring you later on as well. So it comes around. It's really good. yeah, so that's 20,000 yen is about $200 Australian. Yeah, it's a great contribution. Thanks, Dave. Really appreciate it, mate.
Thank you, Dave.
Herbert,
Herbert,
hi,
thank you.
Jonathan.
Herbert's been very helpful as well. He sent quite a bit of donations for actually, so I appreciate that a lot. And it's not got our notice. Everyone's, to the best of my ability, everyone's name has been written down on a long list. So
yeah. Hugo says, I do much prefer your personal voiceovers as the identity is not lost, but that's just me. Yeah.
cheers.
I can understand that. Yeah, I can understand like you prefer someone actually speaking, but you know, sometimes it's just easier to actually get that information out with the AI voice. And you know, like Jonathan was saying, like if you put together all these clips and stuff like that together with your voiceover, that would, I mean, it takes days to edit videos. It really does take time. It's very, very time consuming. Whereas you could do it much quicker with the AI, you know.
Yeah, and the information's the same, but I do completely understand where it's coming from.
Yeah.
You know, absolutely.
Yeah.
I had speech and language therapy when I was little, so I couldn't talk for the first few years of my life. So speaking for me is a deliberate action. A lot of what I say is scripted. I mask a lot, so it doesn't come naturally to me. Sometimes I can kind of reveal the mask a little bit, like in this sort of conversation. But when you hear me doing continuous prose in a video, chances are I've said it in my head about 20 odd times. You know, my social life is scripted. It's just the way I have to go about it.
Yeah, that's fair enough. Yeah, like we said before, like everyone has these, you know, little, you know, points where we're stronger and weaker and other points. So, yeah, so we try to, you know, fill those gaps where, you know, when we can, you know. And I understand too, like people like that more personable sort of interaction where you're speaking into the camera and telling and speaking over the pictures and things like that. But you know, that can be a bit of a struggle, and like I said, very time consuming. A video like that could take, you know, a week or longer to edit sometimes. Just, you know, depending on what you're doing.
Yeah.
Yeah, and you really don't get a lot of, you know, payback for that, like result wise.
No. My butter documentary that I made, the mini document that made about £4 British.
Yeah.
And BC will know how much that would have cost me to put together.
Yeah, that's right. Yeah. So yeah, it's really, this is another thing too. It's like these funds, like we're talking about keeping his channel going as well, is yeah. So you know, this is money that Jonathan is spending quite a fair bit, because it does cost quite a bit to run a YouTube channel, you know, because it's not just YouTube either. Like it's the socials that you need to have as well to promote your channel and to keep the channel going and so on, to grow your audience. It all costs money, you know.
Yeah, I worked out the other day. Actually, I double checked it as well just to be sure, but roughly 35% of the money that I profit from each month or period of time is spent in being put back into the carnivore movement. Just because I see the benefit. I'm not here saying, you know, carnivore didn't work, it failed me. No, it's given me tremendous benefit. In my particular situation, it goes so far. But I've seen people that have been unable to speak with autism that now can, because they've applied the biohacks, the right tools, the right diet. And I see it across the board. I'm meeting people all the time. I'm like, oh yeah, I've got more animal based now. Even my brother, he wasn't an animal based person, but now he's like, yeah, I need to eat my steak and eggs. But he does cook his steak to fuck. So that's the only thing I'll say. But you know, he's getting more meat in, which is valuable, and it's helping him out. And he's 36 years old, and he looks about 30. Looks about the same age as me, ish.
Okay.
A bit older.
Yeah. Yeah, unfortunately, that is the case. I believe that YouTube's algorithm is playing a massive part in the small viewership you get. Yeah, absolutely. I'd say you deserve 10 times more at least. Yeah, exactly. Yeah, exactly, Hugo. Yeah, that's the thing. Like getting the message out on YouTube. You know, we are talking about things that are not the narrative that YouTube likes to promote, and completely the opposite. So this is another thing that we have to deal with is, this small viewership, the restriction that YouTube puts on us. And, it is a real struggle, it's a real struggle because you with the small viewership, you start to wonder why bother,
Yeah.
So,
I mean, I think we would fare better if we did more long format videos, and that the platform would recognize, okay, this guy's putting up more content which people are watching for longer. Therefore, it's producing more ads and ad revenue for YouTube. The problem is, I can't sit on a screen and be interviewed for 3 hours straight. It's not going to happen. So, it's just with the autism, it's a not a mental toll, but it's quite exhausting sometimes. So it's, I try to make videos which are like 10 to 15 minutes long, deliver the answer to the question, and move on to the next thing. So.
Yeah. I think for your situation, that's a good format to keep it in anyway. But like you said, like this is not about carnivore diet didn't work for me sort of thing. Like you do a lot of these hacks, like the carnivore diet. You've got all these other lifestyle hacks that you do that really help you control everything that you're going through, like, or really help you to manage anyway. Like the autism, like you said, is one problem. But with the pain and everything else, this is about. I mean, all these lifestyle hacks and diet will only go so far. When you have a situation where there's no cure, and we never said like carnivore is going to cure everything, right? But it does help manage these things, So this is not about saying, okay, it didn't work for me, it's not working, or so on and so on and so on. It's about doing these things. He's doing the best he can, and he's managing the best he can. But to go that little step further to fill the gap, so to speak, he needs help. You need money. You need money to do all these things. So this is where I think other people can really contribute to just making life a little bit more manageable for Jonathan. So any little bit you can contribute, again, fantastic. Thank you, and we really appreciate every little donation that you can make to Jonathan. If you can't, we know also everything that's going on around the world, inflation, cost of living, everything like that. It is a struggle out there at the moment for everyone. So things that you can help with for free is to help boost his channel, help share a video, like a video. These sorts of things really help. So and he does do a lot for the carnivore community. He really does. He's one of the better ones out there that is actually giving you information that is very useful. Okay. He's not, not giving you crazy recipes like carnivore chocolate, and crap like that. So,
it's funny you say that, DC. It's so funny you say that. Someone literally made. I reached out to probably the largest carnivore person influencer in the UK. It's not Stephen. It's not Richard. No, it's not people I collaborate with openly. He wouldn't even share what I had to say. Within minutes, he's posting things like reels about carnivore chocolate, carnivore hot chocolates, and buy my ebook, my cooking recipes. So it speaks volumes. There's some of us out there trying to help you guys out there watching us. Some of us out there are, some of them are parasites. They provide something, but they don't provide information. They're not sat behind the screen editing videos like we are. They're just getting some PR, send out free ebooks that are made through
parasites. They're trying to capitalize on. They're trying to capitalize on at the moment the trendy movement, and like if that's something else, they'll immediately flip flop, But they come out with ridiculous crap like that, like these stupid recipes like carnivore chocolate and hot chocolate and all this other crap that is not carnivore, that is not healthy, that is, just taking people down the old garden path, so to speak. And yeah, I think people like that are a problem in any kind of movement. You know,
Yeah. Just a
I mean,
caveat. I do have like carnivore keto recipes on my channel, but there's like
yeah,
5 of them. It's not something I'm actively saying do this. It's like, if you've got a child and they're used to eating junk food, this is probably a better option. So I want to make a clear point and calls me a hypocrite sort of thing.
yeah, yeah. No, I mean, I've got maybe 2 recipes. Like a smash burger, and that's it. And yeah, add salt to this, and you're good. Or dip your steak in egg. That's about it.
Depending on who you ask, DC, you've done that wrong.
Yeah.
Salt is rock, remember?
Yeah. Yeah, well. So I've been very strict with carnivore for over a year, and I haven't resolved everything. So I can relate, Jonathan. Some lingering gut and skin issues, but it's getting better over time. Yeah. See, this is the thing. I mean, this is not like it's something like people ask me, like, how long did it take me to heal, for example? Like I'm almost 10, yeah, 10 and a half years now in remission. And this is just an example. I'm not trying to tell you about my story, but yeah, it's taken that long to get to where I am. Like it's taken those 10 years to heal to where I am now. Okay. So it's not like, you can spend, 30, 40 years abusing your body or maybe whether it's intentional or not, on crap food and expect to heal overnight, sort of thing. It doesn't work that way. You have to give your body time to heal. So
Yeah.
there's
We can only
things we need to
expedite
do.
this thing so much, can't we, DC?
Yeah, that's right. Yeah, I mean there are things that are going to help, like the thing like we talked about before, Jonathan. We have all these sort of hacks out there that we love to do that I think are very necessary. Um, and they do help. They help to speed up recovery and everything else. But there's only so much you can do, And like in Jonathan's case, he's doing all of this stuff, but it'll only get you to a point, to one certain point, and then after that, well, you're doing the best you can, and it will get you to certainly an improved position. Like if he wasn't doing these things, he would be in far worse condition. I have no doubt. He'd be far worse off than he is now. But you still need help. There's still going to be there's still going to be conditions where no one's going to be in a perfect position, sort of thing.
Yeah, sometimes it's not so much a case of trying out new things. Like we know the biohacks generally work; they improve something. We know that, but sometimes it's a time thing. So it's not so much of a case of this didn't work in 2 weeks, therefore I need to add in this. If it's as Bart Cahill says, like if it's taking you 20 years to damage your guts, it's probably going to take you a good amount of time to get them back to normal. Yeah, the guts heal quite quickly, but it's the underlying pathology around that. Maybe you've got IBS, maybe you've got some sort of neurological disorder, maybe you don't ground enough, maybe you don't get enough sunlight, maybe your leptin's messed up, maybe your meal timing's a bit off, you're eating too close to bedtime, which affects your gut healing. So, you can just amplify what you can with what the tools that you have that people like DC, Bart, and others sort of promote and advocate for. There's some useful things in regards to like gut health. For me, if my fat intake drastically varies too much or protein, my guts are disrupted. I notice that within a day. So for me, I actually have to track macros as a result of my condition because it means that I feel better and I can measure that through my tracker. So I know, oh, my guts feel good eating like this. Make a sudden change, not good. So that's where I'd look at it. Sometimes it's not doing the new thing; it's sometimes doing the same thing, but for a bit longer.
Yeah, yeah. Well, I think I mean, for most people, it's going to be an ongoing sort of thing, tracking conditions and things like that. So, but I think being on carnivore, for example, makes that a lot easier. Hey, Jonathan, sorry to hear you're not doing so well right now. Hope this helps. Thanks, Rabbi Rob. Really appreciate
Thank
that
you, I appreciate
contribution.
it. He's the nearest carnivore to me.
Oh, is he? Okay.
I believe, yeah, he lives. Confidentiality. He doesn't live too far from me in a sense.
Okay.
Yeah.
Wishing you the best prognosis and outcome. Sent you what I could. All the best. Thank you very much, Victoria.
Thanks, Victoria.
Yeah. Like again, we're not asking people to give them enough money to retire on. We're just asking you to just help out and help him keep going so he can keep bringing new stuff on his channel as well, just to make life a little bit easier for him at the moment. And hopefully we can keep this going for him, because this is an ongoing thing. This is not like a one-off, he'll be right in a couple of months sort of thing. This is, at the moment, looks like it's going to be the rest of his life sort of thing. So we're trying to make it, I mean, like he said before, Jonathan is trying to get himself in a position where he can contribute more and be more self-sustainable, and at the moment that just needs a little bit of a boost. So that's all we're trying to do. So it really does help.
Yeah. I'm getting emails come through now, DC, of like, give, send, go, and things like that. So it is coming up. It is popping up. It is landing. So yeah, anyone that has donated is coming through. So I'm very thankful, honestly.
Yeah, well, that's great. And like again, the link is scrolling across the bottom of the screen there. So you can make donations there, which are, like I said before, like 100% of these donations to this page, the Give, Send, Go, they go straight to Jonathan. Okay. But every super chat you give on Bart's channel, Bart will also pay the 30%. So he's really stepping up. So thanks for that, guys. Yeah, thanks, Darkfield. Really appreciate that. Again, also, I'll just share the screen here. This is the link where you can go and you can read. We're up to £1,378. That's great. Excellent.
Yeah.
Very good. Thank you, everyone, for the donations. Now, you can also read more about his condition, okay, on this page. So, give it a read and, send him a message. You don't have to, even if you don't make a donation, send him a message and just let him know that he's, people do care about him and he's not just being left there to rot like, that the medical system sort of seems to think that they can just forget about him. All right. And I know what that's like.
I do read these guys. Yeah, I do read for each and every one. Yeah.
I know what it's like when you get to a point where the hospital system, they can't do anything more for you. Okay. And they don't want to forget about you. It leaves you in a spot, and like you said before, he's trying to fund all these different tests. He's trying to find and transport and things like that. All these living costs that add up are extremely expensive. So this is what we're here for. Hopefully we can make it a little bit easier for him. So now you said before that you were talking to other people that have similar conditions to you, but of course you are in a very rare sort of, even in that sort of field. Even you are in a very minor. I mean, like you said, it's in your back and your hip and things like that as well. How do other people relate, like in their conditions? Are they having similar sort of problems with the medical system? And do you guys talk about that much?
Yeah, the main bottleneck I have is the advocacy side of it. And I find it absolutely tremendous that this gentleman, DC, over in Australia, is able to do so much on the other side of this globe. Whereas I don't have that's the support that I've been screaming out for. And I have been screaming out actively for a long time. Problem with that, the issue is not an issue, but their predicament is that they can access the information, they can access the help support that they need, government stuff. I just have blockade after blockade in front of me. missing forms, letters that aren't being chased up, things that are being put to the bottom of the pile, missed voicemails, missed emails. It's an absolute burden. So every day I'm anticipating a call from someone I don't know, which is often distressing because, you know, I've had a lot of people try to seen this cause, this thing that we're bringing up here, and try to take it from me, to take my well-being from me. And we're getting Instagram messages from people saying, you know, oh, buy this thing, speak to this person, this email, and send them 750 quid, and you'll be cured of autism. This sort of thing, and it's insane. So I've got to be so careful because I'm not always a gullible person, but I can be. So I'm just very skeptical about what people say to me. I don't have that second ear, that watchful eye. I want to bring a note as well to someone called Mark Ennis, who's an Irish gentleman. He's also a bodybuilding champion, and he's been a great support to me recently as well. And he knows a lot of what I'm going through behind the scenes, and it's the iceberg effect. What you guys hear and have seen in this is perhaps 20 to 30% of what's actually going on behind the scenes. Is dire, truly dire. Issues where I've been discharged from hospital dehydrated, and I've asked for water and they've not given me any. Things like that, like bizarre things which don't make sense. The thing is, the people over here that I've met do have advocacy. They do have help. They do have a support system that's actively pursuing their long-term well-being. That's basically it. So the thing is that I notice is I go to these groups to try and think, you know, I'm not saying I know it all, but there's certain things I'm like, yeah, I've kind of been through this hoop before. I know where it's going to land me. And a lot of people out there just reliant on medications. And I'm going to these groups, these video meetings, and like, this person could easily improve their symptoms somewhat just by applying one of the biohacks I know about. And they'll be in tears each night about a finger with CRPS. I've got it in my spine and hips. You know, and I completely understand it's debilitating. You know, imagine like one day trying to open up a letter. You can't open it. You know, you have to use a tool. So it'll be like a thimble thing with a sharp thing on it to open the tool. So there's hacks around these sort of things, but because the severity of my condition, it's not going a long way in terms of the hacks I provide. But what I intend to do long term, DC, and people listening to this, is advocate for people like me, autistic, CRPS, chronic fatigue, anything like that. Just I live with 3 hidden disabilities. It's hell. But to be able to sort of show, well, yeah, you can live a bit. You can maybe not bodybuild to the level that I do, because it takes me a long time to get the skill set to be able to do it. But maybe you can go to the gym a little bit. Maybe you can socialize a little bit. Maybe you can start a YouTube channel. So that's my intention. So I'm trying to blow this thing up, not just for the betterment of me, but for everyone else like me, suffering in silence.
Yeah. And see, this is what, you know, people really need to see too. Like, it's when people are in situations like this, they really feel alone. Like, there's just no one around them that understands what they're going through. There's no one around them that you know, can possibly that they can relate to. And, you know, like, when you see someone like Jonathan out there, you never know who you're going to, like, who it's going to inspire. Okay. And when they understand the situation he's in, what he's going through, and they figure, well, okay, like, wow, he's doing this, maybe I can do it too, you know. And, you know, there's a number of us like this. Like, this is the reason why I started my channel too, because I know in my situation, it was the same thing. When people was telling you that there's no hope of any kind of future, you're stuck with this for the rest of your life. And, you know, in fact, the rest of your life, maybe, you know, next month, you know, when you just don't know who's going to see you, you know, try, can, you know, get on with your life and actually try something, do something, rather than just give up, you know. Because it's very, very easy for you to, you know, people like Jonathan, to be stuck in bed, just looking at the ceiling. It's very, very tempting to just give up and say, well, screw it. You know, what's the point? You know, and there are days where, I mean, it's depressing just waking up, you know, and you think, well, you know, another day of this, you know, how can put up with this sort of thing. So it's a real struggle.
Yeah, a lot of people in my sort of situation would be like, when's this going to end? And I ask myself that very often. Less so the last few days because I've had some support and it's going to help boost my well-being, which is insane. It's fucking insane, in the best way. But yeah, there's been about 2 to 3 times in the last few months where I've sat there with 3 packets of paracetamol in front of me, just staring at it. And 2 of those occasions, I've been very fortunate to have had like a text from my brother saying, "Oh, by the way, the baby scan. My brother's having a baby in a few days with my sister-in-law, and I got a text come through the last time I felt that way, and it was just saying, "Oh, the baby's normal size, the right percentile sort of thing." And I was like, I had like a sigh of relief sort of thing, like that one little nugget of goodness in my life.
Yeah.
One thing.
Yeah. No, I completely understand that, mate. I mean, yeah, I've been right on the brink myself, man. And it's like it's surprising, like just the smallest thing, that can change your mind to keep you going, and it's yeah. So hopefully, I mean, hopefully we can help you. I mean, emotionally, like just knowing that there is support there, it does make a very big difference.
It goes
Just
a long way,
reaching
yeah.
out, just reaching out, just saying, like chin up, we're thinking of you, sort of thing. These things really do help. They really do help. So
I had a call yesterday with one of my coaching clients, and it's odd. He actually is almost like he was. I reached out to him to sort of say, I know things are tricky at the moment. You got tough stuff going on, but he actually sort of conveyed to me like, oh, me and my wife, my partner, we're thinking of you and this sort of thing. We spent a lot of time talking about that, and I was gobsmacked, because I was the one reaching out to him to help him, and it was reciprocated. He didn't have to say that. He didn't have to use up his time. He's a hard-working guy, busy, works funny shift patterns, and that it goes a long way. So
Oh, that's good, man. Yeah, it's good to know you got friends out there.
Yeah.
Harry's in the house. Good on you, mate. Good to see you.
There's one.
Just noticed you're live, mate. Here's a bit additional help. Thank you very much, Jonathan. Sorry, Harry. Really appreciate that.
Thanks, Harry. Yeah.
Yeah.
Harry's one of the best minds online, in my opinion.
Oh, absolutely. Yeah. Yeah. He's brilliant. Yeah.
He doesn't know he will. Yeah.
Yeah. Yeah. Yeah. I mean, a lot of what he says just goes straight over your head, but yeah, he's a brilliant guy, and so Harry's got one of the most informative channels out there, actually. So everyone should go check out Harry Stepanos with no BS nutrition. Okay. It's really worth it. Yeah, great information, and he's just a really nice guy too, Harry. So, my name Regis, made by Rob. Okay, all right, guys, we're going to wrap it up pretty soon. So if you got any last, please, again, send as much money as you can afford. But again, also Give Send Go. The link is in the scrolling across the bottom of the screen there. Any little bit you can do would really help out a lot. And also, if you can't contribute, like we said before, just give a like to some of his videos, share them if you can. That costs nothing, but it really does help out his channel, which will in turn help him out to try and raise a bit more revenue for him as well. If you can also go to his webpage, he's got in the description, you can buy his ebooks. All right. All very, very good value. I mean, again, about $10 for a 170-page ebook. It's a cup of coffee, like people spend on Starbucks every day easily.
Yeah.
Easily that. So if you can manage it, it's certainly well worth it. If you can't make a donation, that's fine. We really appreciate the fact that you're thinking of him, and again, these ebooks that he's got for sale, they really help him out as well. So if you can, scoot over to his website and check it out. Juliet, thanks again. Another super chat. Thank you. Happy to see you.
Juliet's an example of someone that perhaps can't afford it, but she still tries. And honestly, $5 will go a long way anyway. So I'm just grateful for that advocacy and spreading sort of autistic carnivore movement.
Yeah, and this is the thing. It's not like we're not asking you to give up more than you can afford. And like I think I really appreciate when people like they have you think about percentage of how much they're giving. Right? Some people that can't afford much. So like they got $100 and they give you $20. That's whereas compared to like a millionaire will give you $100. Percentage wise, they're giving it a far greater. They're far more generous. So even if you just give $1, every dollar helps. But again,
other people see it as well.
Yeah, that's right. Other people see it. You never know who's going to see it, and they might help out. But again, if you can't, that's all good. We're not asking you to give what you can't afford. And there are other ways that you can help out the channel as well, like sharing the videos, okay, which cost nothing, right? But it really helps him out. This is talking about information too. Like we're talking about. I mean, there is a lot of carnivore channels out there, but the really informative carnivore channels, like we're talking about Harry, we're talking about Bart Kay, Richard Smith, Stephen from what's Stephen's
Thomas.
channel? Stephen Thomas, what's his channel?
UK Carnivore, I think.
UK Carnivore. Even Lee Copus. He has great videos too, really good. But generally speaking, majority of them are not really. They're sort of more blog style channels that don't really have a lot of or share a lot of information. But these are a few channels that really do give you great information for anyone that's trying to get healthier. But Jonathan's one of them. Jonathan has some of the best information that you can find, and especially like these days, it's very popular for if you get into bodybuilding or just starting in the gym. Doesn't mean you don't have to be a pro bodybuilder, but even if you're just starting exercise and get hit in the gym and that sort of thing, he has a lot of great information that will really help people out. Okay. And he's like, again, we're not here to try and retire him early. We're here to try and keep him going, so that he can keep giving you this information for free,
I'm working on a project at the moment, which is it's going to have quite a humorous slant to it, and it'll be AI. You can probably imagine what it's going to be, but it's with any surplus of money that I do have, that's what I intend to spend it towards. And it'll be kind of funny, kind of entertaining, but also educational as well.
Oh, that's good. Yeah, humor helps with education. Let's do the fundraiser again. Yeah, absolutely. Once a month, why not? Again, this is not a one-off sort of thing because Jonathan's just trying to get into a position where he can be self-sustainable. Okay, but it's really difficult to work when you're stuck in bed for 20 hours a day. All right, so that really limits your ability to actually be self-sustainable and to work and produce and that sort of stuff. So this is why we're here. Every little bit will really help him get to his goals, and he's not asking you to give everything, give you the house sort of thing. Jonathan has helped me a lot. He really knows his stuff. Yeah, excellent. Well, that's good to hear. It's good to hear that he's helped you. I think
helped me a lot.
Has he? Well, that's good.
He's good. My audio tech guy, but he's limited in he speaks English as in we can converse, but even with his limitations in understanding and vice versa, we still collaborate to work together to produce good audio content, things like that. He lives with a similar condition to me, but his symptoms are different, as in he doesn't experience all day pain, but he has to be so careful. If he bends down a bit too much or even stands for too long, he'll be crippled for like weeks. So it's a different situation, but he's another workhorse. He whenever I've needed help to speak to someone, he's been there. So he's an absolute asset.
Oh, that's great, man. Yeah. So, man, what a condition. It's horrible. Yeah. Well, it's good to hear that you both help each other out, and that's good. Yeah, and keep working. I mean, this is the thing too. People don't understand. Like, it's so easy for people to just, give up and say, "Well, I can't do it. I'm not gonna work. I'm not gonna bother trying to, do these things myself." Most people do that. They do give up. So I think it's really tough to keep going like that. Especially, you don't get a lot of thanks really when you do these YouTube channels. You don't get a lot of thanks for the stuff that you're actually doing. And like you said,
you do see like the amount of people that create content related to your experiences. There's not many. I mean, Andrew Scarborough, yourself. There's probably a few other that you're better connected with, but outside of that, you're pioneers in your own area. So there's value to it, and it does help people. So
yeah. Well, we hope so. We hope it helps people. It's difficult to get the message out there though, and it's like you said, it's very sort of small sort of window or field of people, I guess. But there's a lot of stuff that people don't see in the background, like you say, things that are going on with you, and everyone. It's just it makes it tougher. But there's at least, I mean, like you were talking about before, small messages, of help, they sort of keep you going, and people they don't really realize what an effect. So like you don't know who you're going to inspire. When you make these videos and you talk about your situation, talk about what's going on with you in the background, what we're doing today, um, and people like your friend here, you inspire each other, and that's incredible what you're doing. It really does inspire, because you just don't know how many people are suffering that might just need to hear that message. So really
some
cool.
messages do resonate so much with me. I mean, the experience I have is quite different to a lot of people, I guess, but I know people are like, "Oh, I live with autism," and I found this quite helpful. And if you ever want to chat, and I had quite a few people the last few days that have reached out personally, sort of thing, to say, "Look, I don't want anything from you. My number's here. Text me if you want." Right, that's it actually goes a long way, because you sort of meet these people and you find out what they're doing, and you're like, oh, okay, they're managing things. Okay, maybe I can leverage my sort of willpower a bit today, and try and set an objective. So it's I do have bad days. We try to remain as stoic as we can as carnivores. The carnivore stoicism is a thing, I think. But as long as it doesn't go all the way, so as long as you get that message and it just hits the spot.
Yeah, you're right. Yeah, I mean, we all have our ups and downs. I mean, being carnivore and having these other life hacks, they do help. They do help to keep you emotionally level, a little bit more clear-headed, and so on and so on and so on. But that doesn't mean that life is all beautiful and there's rainbows everywhere you go. It's just it just helps you to manage the tough times a little bit easier. But that doesn't mean there's not going to have tough times. And we still have our days. There's always going to be those days where one day is going to be more of a struggle than another. That's all. But but that's why you have friends, and hopefully every now and then you get a good message come through, and you think, well, maybe it's not so bad, and we'll sleep it off, and tomorrow is another day. There's always that I don't know. I think you're much the same as me in that respect. There's always that little. I mean, you have those days where you think, well, yeah, I don't know if I can get through today, sort of thing, and you really some strange some things that really go through your head that we probably shouldn't talk about here, but then you have those days where you think, well, yeah, I'm going to keep trying, I'm going to keep doing it, I'm keep going, and there's still things in life that I want to do, and that's what kept me going. There's still these things that I want to do. So
Yeah.
there's good and bad days. There always are. There's always going to be good and bad days. Some days will be better than others, and other days are going to be an absolute bloody nightmare. But we do what we can,
Yeah, that's it for sure.
Yeah. Well, I think we'll leave it there today. But I think we might, like we said, I want to thank everyone who participated today, who donated, and please, again, free to just share and like videos on Jonathan's channel. This helps him out as well. It doesn't cost you anything to do that, but it does help him out. If you can go to the link below again, make a donation. He gets 100% of these donations. And there are other options. You can buy the ebooks. Okay, again, dead cheap, like $10 for an ebook that will really get you started in carnivore, nutrition, bodybuilding, or just general well-being, going to the gym, starting exercise, things like that. There's a lot of ways you can help him out here. There really is a lot of ways that you can really help.
Yeah, there's a free ebook on my site as well. So all it is like an email, your name basically you have to submit, and it's £0, £0, no shipping fee, nothing, no cost to you. So you can, if someone's got zero money and they've done the like and the share and they're like, I want to get something for this, you can still get that. So
yeah, that's great. All right, so I really want to thank everyone again. It really does help, and it's just great to know that there are so many people out there that are thinking of you, Jonathan, and I really there's so many. I mean, it's really good to see a good community of people coming together to help a brother out, and because life can be a struggle for many people, especially these days. But when you understand the situation that Jonathan's in, okay, and try and understand just how much is going on for him in the background. It's not just all about this YouTube channel, what's happening on YouTube and so on. Okay. So please even just share this video, and again, the information for donations for Give Send Go are in the description as well. And that really helps. It really does help. So help a brother out, okay? And just let him know that you do care. All right, everyone. Thanks very much for joining us. Any last words, Jonathan?
Much appreciated. I just wanted to say thank you to everyone that has supported me so far. Even the messages, even 50p or whatever, it does go somewhere. It's not being squandered. It's not being left or ignored. I'm gonna make use of this situation, put best foot forward, and hopefully continue on as I am, and put myself in a better position so I can deliver more of what content people want that actually helps them. And that's going to be my way of giving back, and hopefully I can continue to do that for as long as I possibly can.
Yeah, very good. And hope to see us both do another stream again soon. Yeah, you can be sure on that. Like Jonathan and I, we get together. We like to do even the Q&As that you see us do together. Like even just participating in that really helps Jonathan out as well. All right, it helps out his channel. So if you can, just keep watching Jonathan's channel and share those videos. Again, it doesn't cost you anything. That does help. That builds his revenue as well. All right. and helps generate income for him. All right. Excellent. Thank you, everyone. Again, really